On the Medical Watch tonight, are you protected against the measles?
Medical reporter Dina Baer has some answers as Chicago faces an outbreak.
Most adults received the measles, mumps, rubella, or MMR vaccine during childhood. The two-dose regimen is 97% effective against measles, yet the virus is widely circulating, and doctors are concerned. The count is growing, many coming unvaccinated against measles. The challenge now is containment.
Many of these migrants don't stay in the shelter all day long. They're out on the street, or they're riding the CTA buses and trains.
Migrants in Chicago receive standard vaccines at Cook County Health's new arrivals clinic, but there could be a lag in building protection.
Usually it takes around 2 weeks to get that high, but at least you're building immunity after you get the vaccine.
The highly contagious virus spreads when an infected person coughs or sneezes and can remain airborne for 2 hours. Up to 90% of those within close range of an infected individual are susceptible to the virus if they've not been vaccinated or they received just one of the two-dose regimen.
I'm seeing more young adults who might have gotten their first dose of vaccine but didn't get any vaccine after that.
Signs of infection are fever, cough, runny nose, red eyes, and a rash of tiny red spots that starts at the head and spreads to the rest of the body.
It's going to be more serious in the adult population that can get measles. They can get pneumonia. They can get some hearing loss. I mean, measles can cause deafness. You can get encephalopathy and meningitis from it. So it's not a benign disease.
Unlike a tetanus shot, an MMR booster is not recommended for those fully vaxxed as a child.
If you got 2 vaccine doses at appropriate times, you are protected.
According to U.S. guidelines, children should be vaccinated at 12 months and again between 4 and 6 years old.
This is an absolutely safe and very effective vaccine.
Still, there is a global outbreak that may impact upcoming spring break travel.
20 states around the U.S. that are having measles outbreaks, and there are multiple countries around the world that are having outbreaks. And with spring break coming up, and especially with people going to Florida, where there is a measles outbreak that is occurring now, it's going to be extraordinarily important that they are up to date on not just their other vaccines, but on measles vaccine to prevent them from contracting the illness.
The CDC recommends an MMR booster for college students, but mostly to protect against mumps. Older adults who were born prior to 1957, before the MMR vaccine, likely had a measles infection, which would provide some immunity. Back to you.